So 26 confirmed positives. Of this 26, 17 are imported cases, 8 are import-related cases, and 1 is still under investigation. The new case is a 70-year-old male from Clarendon who is a son-in-law of the one person who was deceased from COVID-19 to date here in Jamaica. In terms of testing, we have now tested 150 samples. 26, of course, would have tested positive, 124 tested negative, 18 results are currently pending. In the meantime, 17 persons are under quarantine in a government facility, 142 are under quarantine at home, and 254 have been released. These, of course, do not include the quarantining arrangements at 7 to 8 miles Bull Bay and Cornpeace settlement.
Up to present date, we have received so far materials to do about 3,000 tests from PAHO. In the event of a spike or testing methodology changes, and this will, with the reagents that we presently have, it will allow us to double the number of tests that we are able to do. In either case, we therefore have 2 months' supply of testing material. We have requested from PAHO additional kits that we will receive within that time. In addition to this, the Minister of Health and Wellness is exploring the use of rapid test kits. So within the next few days, we expect that we will come to a consensus on the types of kits that we will use for these rapid tests and the protocol that we will use to conduct these tests. But in the meantime, I want to reassure the public that we do have enough test kits in place to conduct this surveillance as well as the testing of persons that are suspected cases.
We have taken a decision that in the coming weeks, we are going to engage the private sector under a public-private partnership arrangement, PPP, to outsource some of the services that are currently being carried out in our public health institutions, our hospitals in particular. We have decided to, under this arrangement, take out 2 highly vulnerable groups, persons who have chronic hypertension and persons who are diabetic. And the idea here is to outsource those 2 sessional visits by this population to private practitioners who will see them once or twice per month. And we want to do this for approximately 4 months in the first instance. We anticipate that this will cost us some $350 million over that period of time. In terms of the community quarantining arrangements, I just want to raise with the public that the Bull Bay 7 and 8 mile arrangement, based on the clinical assessment of when it started and the time required to complete this process, in other words, to discontinue the quarantining arrangements in Bull Bay, the decision has been taken to complete that arrangement on Saturday, the 28th of March. And so to the residents, to the citizens of Bull Bay, we ask for their patience until end of day Friday, at which point we will resume normality in that community. And again, that demonstrates that what we're doing, we think, is correct. We continue to carry out the necessary surveillance. And again, I extend our appreciation to the residents of that community and ask for their patience as we seek to manage this process. As we discover these additional cases, it's important for us to appreciate as a country that these are expected under the existing circumstances. And I don't want the Jamaican people to lose hope or to feel that we are not making progress even with each positive case that is identified. We are doing well under the circumstances when compared to other jurisdictions, and I want to commend the health team for the work that they're doing, and the government for the support, and all of Jamaica, frankly speaking. However, community spread should not allow us to panic, even though we are likely to see a lot more cases. What it should do is to allow us to be more concerned, yes, and to take the necessary precaution to manage through to its completion as quickly as possible. In other words, to flatten the curve.